So what this really means is Illumina partnering Illumina's next-gen sequencing technology with the world-leading genomics research expertise that sits within the Centre for Cancer Research here at the university, partnering these together to really implement genomics into practice. So, leveraging our partnership together, Illumina and the University of Melbourne, together with the support of the State Government of Victoria and with a specific call out to Invest Victoria, have established the Advanced Genomics Collaboration, or TAGC, which is really intended to be the engine through which we advance genomics innovation and commercialisation here within the biomedical precinct. So in addition to delivering significant economic benefits for the state, whether that be through the creation of jobs, development of the workforce, or just boosting commercialisation activity here within the precinct, TAGC really aims to position the precinct as global leaders within genomics research and innovation, to really realise a future where genomics does have the potential to transform how we deliver healthcare. So, as I mentioned before, TAGC is really aimed at driving genomics innovation and commercialisation here within the biomedical precinct. And in addition to really accelerating the translation of this research and these innovations through commercialisation into a cluster of high-growth, high-tech startups that will hopefully set up shop and become part of the Melbourne Biomedical Precinct. So TAGC will be run over a period of 5 years and through 2 distinct phases of work. Phase 1, which we are almost drawing to a close, has really been focused on establishing the innovation foundations that will underpin the future success and growth of the initiative going forward. And so phase 1 has really focused on 2 key areas of work. The first has been the establishment of 3 genomics core enabling platforms, and the second has been in relation to supporting 2 flagship genomics innovation projects. Phase 2, which we're about to kick off in 2023, is really about moving from establishing the foundations through to growth of the innovation pipeline. And again, we'll be doing that through 2 key areas of work. The first is in relation to expanding the commercialisation pipeline through looking to support the next cohort of innovation projects, in addition to really paying particular attention to the way in which we build the genomics workforce of the future. So recognising that as we continue to grow the genomics sector within the biomedical precinct, it'll be really important that we've got the workforce to support the growth of that sector. So, as I mentioned before, one primary area of work in phase 1 has been to establish the core enabling platforms. And these core enabling platforms are really at the heart of the TAGC and will be vital to ensuring the ongoing success and growth of the initiative moving forward. The development or establishment of these core enabling platforms really provides an example of how Illumina and the University of Melbourne are working together, so pairing Illumina's technology with the research expertise that sits within the Centre for Cancer Research and working together to establish these platforms that are now sitting within the Centre for Cancer Research here within the precinct. So the first core enabling platform, which is being led by Professor Sean Grimmond out of the Centre for Cancer Research, is the Clinical Genomics Platform. And what this platform really intends to do, or aims to do, is enable rapid, affordable whole genome sequencing at scale. And so what this means is reducing the time and the cost that it takes to actually sequence a patient's genome. And in doing so, this will really enable genomics to become a part of everyday research, but more importantly, part of everyday routine clinical care. So given that we're now in a position where we can sequence at scale, it's obviously generating a lot of data, and so this is where the Bioinformatics Platform comes in. So this platform is being led by Professor Oliver Hoffman, again within the Centre for Cancer Research, and utilises Illumina cloud-based technology to really enable the creation, the storage and the analysis of large genomic data sets both at a national and a global level. This work is also around reducing the time that it takes to perform the analysis, so from 72 hours down to 12 hours, and again in doing so really just provides improved diagnostic outcomes and enables our clinicians to be providing more targeted and effective healthcare for our patients. The third is in relation to the Health Economics Platform, and so this platform is really about establishing the evidence base, both from the health outcomes but also the economic benefits of embedding genomics within healthcare, to really inform public policy and investment within this space going forward. And so obviously a lot of this work involves working really closely with government stakeholders to ensure targeted research is being directed towards this area. So as I mentioned before, the second focus of phase one has really been to support the first cohort, or two flagship genomics innovation projects, which are being carried out by researchers across the university and the Peter Doherty Institute. So the first project is ID Predict. This is being carried out by Professor Sami Badawi at the Doherty Institute. Professor Badawi is really focusing on developing a genomics-based platform to support effective treatment for patients who present with COVID-19, but other infectious diseases as well, such as TB. And so this platform really utilises genomics and clinical data combined with AI technology to really develop a powerful decision-making tool, as I said before, that can predict disease outcomes in patients with COVID-19 and other infectious diseases, and again enables our clinicians to be providing targeted treatment options for these patients. The second project is being led by Professor Sean Grimmond at the Centre for Cancer Research in relation to the development of the cancer liquid biopsy. So this is a non-invasive blood test for the detection of cancer, which really relies on the detection of DNA fragments that are circulating within our blood from tumour cells. So this kind of technology also allows for simpler and more effective diagnosis of some of the most challenging to treat cancers. And Professor Grimmond will also be working to establish parameters and protocols to support the blood collection process and also the testing that's being undertaken in hospitals outside of Metro Melbourne, so really providing more equitable access to this technology for patients who live in regional and remote areas. So both the ID Predict project and the Liquid Biopsy project are receiving funding through TAGC to support the growth and expansion of their initiative. In addition to that, they are utilising the core enabling platforms that I just spoke about prior. They're also utilising Illumina sequences and reagents, and in addition to that have been working closely with commercialisation experts from both the University of Melbourne and Illumina, who have been supporting them on their commercialisation journey. So these first two projects, ID Predict and Liquid Biopsy, are really just the beginning of growing the genomics innovation pipeline within TAGC, and they provide really strong examples of how we will continue to partner with researchers and other organisations as TAGC begins to grow. So as TAGC progresses and we begin to build key research capabilities and the like, as we move into phase two, we will be looking to really onboard the next crop of translational genomics-based projects with a view to really starting to grow the genomics innovation and commercialisation pipeline here within the precinct. And in addition to that, as I said before, we'll also be starting to look at how we can start building the genomics workforce through the identification and creation of a whole range of student opportunities, whether they be PhD-sponsored projects, internships, placements, and the like. So, with that being said, today I'm really excited to share a new opportunity such that later this year we will be inviting genomics-based projects that are being carried out within the precinct and that can demonstrate commercial viability or feasibility. We'll be inviting these projects to apply for funding through TAGC. So we expect the expression of interest or the EOI process to open later this year, around Q4, with an expectation that successful projects will be onboarded from the middle of next year. Now, as I said, projects will be invited to apply for funding of up to $2 million across a 2-year period. In addition to funding, successful applicants will also, similar to ID Predict and liquid biopsy, they will also have access to Illumina technology, sequences, reagents and the like. They will also have the ability to utilise the core enabling platforms that are being developed within the Centre for Cancer Research. And in addition, again, we'll have an opportunity to work really closely with commercialisation experts that sit both within the University of Melbourne and Illumina, who will work closely with them for the duration of the 2 years to really support their commercialisation pathway. So a little bit more around eligibility and the kinds of projects that we're actually looking to fund here. So as I said before, we are looking for projects that are being carried out across the biomedical precinct that are utilising or developing genomics-based technology to develop a product, a solution or a broader application. So we are looking to cast our net quite wide. We are looking for projects both within the health space but also more broadly in other areas of application as well. We are looking for projects that can demonstrate growth, particularly through the creation of new jobs. And we're also looking for projects or initiatives that have an ability to incorporate opportunities for student engagement as well. So again, going back to that piece around workforce development. And more importantly, we're also looking for projects that have an intention over their life cycle. It may not be within the first 2 years, but certainly in the medium to long term, to ultimately be spun out or licensed or commercialised in some other way, shape or form. And one final slide, also around eligibility. As I mentioned before, we're looking for projects that are based within the biomedical precinct. And for that reason, we are looking for applications to be based at either the University of Melbourne, so it might be, so faculty, broad faculties, any faculty can apply, I should say, and also within our MAC partners, so Melbourne Academic Centre for Health organisations. You can see their logos on the slide behind me. So if you're interested in further information, I invite you to jump onto our website at tagcaustralia.com. You can register your interest in receiving email alerts, so you'll be alerted as to when the EOI opens. Otherwise, happy to answer any questions that you might have today. And I also note that we've got some friends from Illumina in the audience here today as well, should you wish to speak to them. Right, thank you. Hi.
I'm a retired public health doctor, work around the world, so my interest is in public health. My question is, what are the applications of this research to improve public health?
So as I said before, we are looking for genomic-based innovations broadly. And it is the intention that we are really supporting these genomics-based projects to be commercialised for broader application within the healthcare system. So at this particular point in time, the application is broad within the healthcare system. I don't know whether I can answer your question specifically.
Government health policy in terms of preventive
I will be quite honest here. I don't have a health background at all, so I don't feel I can adequately answer your question in a way that it deserves.